Thanks. It's a question for Autism Burgos. Is your tool available? Can we have access to that tool?
Yeah, you can access to the computer program in by the website La Muralla. Maybe I will write to you.
Okay.
It's La Muralla, LAMURALLA.
Lamuralla.com.
Lamuralla.com, yeah.
Okay. And is the tool user-friendly, or does it require specific training? So we can...
No, it's really, really easy. It's for everybody, and only you have the indicators and are sub-indicators that you match in a explorer tablet.
So we can download it from the website.
Yeah, it's really easy.
Okay, thanks.
No, it's not yet, but we want to translate it.
Right. You need to take the microphone so that you...
I want to repeat my question. I didn't explain it well. I said nowadays mental health care institutions, psychiatry can discover that you are 65 years old and that you suffer from autism, and you didn't know before, and mental health care did also not before know. Is there adequate help then?
Yeah, in our country, there are some organizations, for example, in Autismo Burgos, we have a program for Asperger's syndrome and PDD, and we make diagnosis, and it doesn't matter how old are you. And if you are an adult, we are going to make a center plan in the person, and we are going to work with your age and with your needs from your age. We need to develop a lot of services for adults with Asperger, because it wasn't frequently adults, but we work with all the spectrum. I don't know in other countries.
I think it's probably fair to say that in whatever country you are, that services are very patchy. That, sometimes if you live in the right town or the right place, then you can get good facilities because there are good models being developed. But if you live in another town, you may well not get those services. And there's some evidence that suggests that adults with autism who are of lower intellectual ability actually get better services than people who've got higher ability Asperger conditions. Very little exists for them, even though for adults with more severe intellectual impairments, there may be better facilities. So it's very patchy, and I think on the whole one has to say facilities for adults are much less well developed universally than facilities for children.
And also I believe that there is a great lack of education of psychiatrists about autism. In my country, I don't know, maybe one of the psychiatrists all over Greece that can diagnose autism in an adult.
I think it is a problem, particularly when psychiatric training is split. So you get child psychiatrists who know a lot about autism, but adult psychiatrists who know very little about autism or other developmental disorders. Do we have any more questions?